All right, people, we are here. It's Dr. Frank. It's episode 4 of the Pro Aging Podcast. And I am so happy to finally have this guy kind of mano a mano with me. We've done, I think, IG Live together, but I'm so happy to get like some quality time with him. The world-renowned plastic surgeon, Dr. Julius Few. Now, I'm not going to spend too much time going over his glamorous CV because that'll take up the whole hour. But, he practices in Chicago. And you would think I wouldn't see a guy like this that much because he's a plastic surgeon and traditionally we do things differently. But this is one of the few plastic surgeons I've ever met who really has put his foot in the expertise of a multidisciplinary approach to beauty, meaning non-invasive versus invasive. And many of you have probably heard me say that people who stick to invasive stuff should stick to that, and people, you can't be great at everything. But this is really one of the few guys that every time I see him, I just want more. He has developed the concept of the continuum of beauty, which is really kind of this long life approach to combining these different techniques to kind of find the best version of ourselves. He's got a long list of media stuff going on. I even said, when we do promotional things, everyone always sends each other's bios. And I think we both know each other's bios pretty well. But I was shocked to see this stuff about consulting on plastic surgery for Saddam Hussein or Osama bin Laden. You may have to tell me about this. These guys, I guess, when they're alive, they wanted to change the way they looked. We may have to bring that up. But I also know he's kind of expanded his own brand. He's worked with Goop. He's on LA now doing different things. And I'm super excited to learn some more from him. So, Julius, I hope that serves you well. Welcome.
You're too kind, buddy. I'm so honored to be here with you. And I too have gotten to really enjoy and watch your evolution. I mean, you started at the top shelf, and then you jettisoned from there. Certainly with your pro aging work, which I have thoroughly enjoyed. And the funny thing is, I was saying, and we kind of talked about this just before jumping on camera, the idea that I was introduced to you by a mutual friend, Christy, who said, you know what, you got to meet this guy. He's an innovator. He's a rock star. And you guys would get on really well. You're like brothers. And the truth is, she was 100,000% right.
That's right.
And
we were both younger and cooler.
We were. We're aging backwards, as you said.
You're not doing so bad ourselves. The handsome twins.
That's right.
But anyway, let's get the interview going. To me, again, like I said, I've always been impressed that I see you at derm meetings. You're renowned in the plastic meetings. You really academically, you're not just like a plastics guy who's like playing around in the derm world. And I think you really have a very academic approach to that. How was because you've been in practice quite a while, like I have too, over the years, given that you're formally trained as an invasive plastic surgeon, how have you seen that transition, what percentage, into the less invasive procedure?
Yeah. So Paul, I may have touched on this indirectly when we've gotten together at meetings and things like that, but my story, or kind of the evolution, started really with the idea that I wanted to be able to treat a diverse population in cosmetics, and at the time, and this was back in the late 90s, really it was, first of all, there was this faction of it's dermatology or plastic surgery. This is the only way to go, which I never liked, the idea of trying to short circuit expertise. But the second part of this was really the idea that there were very few options for skin of color. And so what happened was, and I have to give credit to Mike Kane, who's also in New York. Michael came to me because we had friends in common. I had met him at a plastic surgery meeting when I was a fellow. And as you know, I did some oculoplastic training in New York. So I had met Michael through that connection. And Michael at the time said, hey, I want you to come to this meeting in Canada pre kind of release of Restylane, which, as we know, is the first HA filler. And when I was there and I was sitting in this conference hall, I'm a young plastic surgeon, and I'm listening to all these incredible minds kind of talking, especially in the derm world. I was intimidated by that. But what I was struck by at the time was the idea that all of my colleagues were against the idea of doing fillers in skin of color. And the idea was, well, you can't do that because they were telling the company, Medisys at the time, you have to put a black box warning on Restylane against using it in skin of color, especially African Americans. Otherwise, there's a risk of keloids. And they said,
No.
well, I swear to God, they quoted Voorhees and they said, well, neocollagenesis, expanding fibroblast. I mean, all these technical terms. And at the end of the day, I got up. I was nervous as hell, but I got up and I said, I'm sorry, but has anybody done a study?
That's a little racially charged, if you ask me.
And I was I think I may have been the only person of color.
Like they're not important, and you don't want to take even the slightest risk to do the research.
No risk at all. No risk at all. So what I did is I was fired up, and again, I probably had a shorter fuse back then. Especially,
Absolutely.
I go back to Chicago. I'm on staff at Northwestern. I'm involved in teaching the residents, all 9 yards. So anyway, I was able to do the study, and we looked at over a year. Actually, it was a little more like a year and a half. We looked at a comparison in a controlled way between those with fair skin all the way through the Fitzpatrick or the darker skin tone. And not only did we show that there was no issue with skin of color and injection, which now everybody knows, but back then it was a big deal. And then the second part of it, and probably the reason why it's not so common knowledge in the derm space, is that this was published in Plastic and Reconstructive Surgery, and the title of the paper was Restylane and People of Color. That just tells you it was the trade name for the product. That's how new this stuff was.
Okay. I mean, this is exactly why I had you on. You're throwing me tidbits here. I don't want to get too crazy political, but do you continue to see, as you've seen with this, these type of racially influenced kind of lack of attention in the companies throughout the years in terms of the research and things of that nature?
Well, it's interesting, the timing because I do believe that I've been very fortunate to be where I'm at, and I've been helped along the way. I mean, so I can't take credit alone.
And as you are helping along the way.
Well, I'm trying, and so I'm trying to get back that way. And so one of the things that has happened is, I've been able to actually have a platform to reach out to the companies, the various companies, and say, you've got to do a better job. We need better diversity and focus and so on. And I've been very, very pleasantly surprised at how aggressively the companies have responded in saying, okay, we're going to put real money towards really inclusion and evolution in this area on multiple platforms. But I was alone in that regard for a little while. And back to your original kind of question, what I realized was the writing on the wall, which I give my derm brothers and sisters credit for, is the idea that if you had the choice between doing a surgical or a non-surgical approach, you're going to choose, if you can get the similar result, you're going to choose non-surgical. I would. I mean, anybody would, right?
Yeah. You can't always get the same result.
You can't. You
need to understand the continuum.
Absolutely. And you also, you do surgical fat-related work and
I refer a lot. I do refer to plastic surgeons a lot.
You refer a lot. So it's the understanding that there's this delicate balance, but I think that what happened along the way, ironically, I was trying to carve out kind of exposure for those who have skin of color, and along the way, guess what? We ended up figuring out some things that are beneficial regardless of what your skin tone is in terms of reducing kind of the local tissue trauma. So,
it's funny. In New York, and again, I don't know if it's because of my practice or my upbringing or just demographically in New York, and again, I think companies respond, pigeons go where the crumbs are, they go where the money is. And the fact of the matter is, some of the largest growth in the cosmetic industry right now is in skin of color, just like it was years ago with men, and now you have millennials. So, again, of course, they want to put research in place to make money. In New York, and you've trained in New York, you see the melting pot that we have here. It's like, I've always, by default, had an extremely racially diverse practice because that's New York. I've always had 30 to 40% men. It's odd because sometimes I lose perspective that the rest of the country maybe just doesn't function like that. You know what I'm saying?
It's true, and you're right, and part of it too is you're an open-minded thinker as it relates to kind of clinical excellence. You want to be good for everybody who's coming to your door, and are better than good, exceptional. And so
Yeah.
to me, that's really where this all goes. But
That's amazing.
crazy,
So
crazy.
about all these different procedures that you do, I don't, what are your favorite things? I know you could say everything. It's always the combination of things. Are there certain things you're like, I am definitely the guy that you want for this procedure, that you love to be in the OR or on the side with?
My sweet spot, my jam is definitely around the eyes.
Yeah.
And I just had a 75-year-old woman who runs a very successful business here in the city in Chicago, and she's 6 weeks out, and she looks
Yeah.
freaking amazing. I mean, these are her words. I saw her this afternoon. She made my freaking day. It was
That's
just
amazing. No,
and so
that's when you get.
I love eyes surgically and otherwise.
It's when you get into the zone. I always say,
I was in her situation it was hard. So I do very complex periorbital surgery. I've helped write books about it. Our plastic surgery encyclopedia, I wrote the chapter for that for the last, I don't know, 7 years. But it's something that really is a passion point, and it jumps off of some of the other continuum things that.
now that you bring this up, I want to get a quick answer because there's all this controversy. You and I both know filler can be such a great asset under the eyes. It could also be the downfall for so many people because the biggest risk of eye filler, non-invasive rejuvenation, it's not pain, it's not inclusion. I think it's one of the safest areas of the face if done right to inject, but aesthetically the risks, the type of work that's out there, if you're not an advanced injector and you don't know how to undertreat and respect the area, not only do you mess up the way the patients look in the short term, you are messing them up for guys like you when they eventually want surgery. Because again, with surgeons I work with in New York and patients I have to melt down for other surgeons to get them prepped for surgery, vitrace away. I mean, tell me a little bit about this, because as someone who does filler and surgery, I want our audience to respect the balance.
And I've seen your work. I know that you respect the balance. I think, 100%. My goal when I do filler to the under eye area, the basic rule is 85%. I try to only go 85%, and people will come in and say, "Well, wait, I feel like I have a little bit left." No.
I knew I loved this guy.
No. We're stopping here. This is where we go. We're not going to go any further because the truth is, if they get a cold, if they get into a warm climate or whatever, things that
COVID vaccine.
Or the vaccine, exactly. And I actually on that point, and I watched your Instagram, kind of your live work, or not live, but on your story, 100%. The reality is, I've seen this with the flu, where people will get localized swelling. Lyme's disease. And so to me, I think any inflammatory process in the body, you need to give a little bit of room so the product can react and not look crazy. We're on.
All right. Well, let's talk about something that you're very well known for, regardless if it's your favorite thing to do or not, but that's the threads.
Well, I love the threads. That was going to be number 2 for sure.
Yeah.
So and here's the crazy thing is that I swore up and down that I wouldn't do threads.
We all do that.
I remember back in like 2005, 2006, I said, hell to the no, there's no way I'm going to be doing putting tennis racket string in somebody's
I'm a plastic surgeon.
I'm a plastic surgeon. I'm with that. So anyway, what ultimately happened was, when I was approached by the manufacturer and the person who ran the company, I gave a laundry list of things that I felt were problematic, just based on the history of threads. And literally every problem that I pointed out, he said, well, we did this for that. And ultimately went down the entire list. and the fact that it's biodegradable and so on. So fast forward, again, reluctant, Paul. I mean, I did the surgery and everything else, and I still believe surgery is gold standard. But what ultimately happened is I did one case. I remember it so clearly, on this really pretty 41-year-old, beautiful 41-year-old who barely needed anything. You certainly wouldn't do a facelift for her. And the change was notable, but again, not super crazy dramatic. She literally in 2 weeks had 9 friends who wanted to come in and get it done.
It's the best.
I'm watching this and I'm thinking, what just happened here? I've never seen anything that has evolved like that. And so now, almost 4,000 later,
it's amazing.
It's just, and I do love it. I really do.
There's no better PR than a happy patient. People always ask me, like, what do you do for PR? Could you just hire this? How much do you have to pay? I was like, focus on the happy patient, okay?
100%.
So, I do threads also. I do them probably more limited than you and less invasive than you. I, like you, I'm sure, those Aptos feather lift threads from like 10, 15 years ago that weren't absorbable. I started with those in the early days. I use some of the lighter barbed ones. You use the silhouette ones, correct?
I do.
Are those the only kind? Have you brought in other brands of threads?
No, I have. I like the PDO barb sutures. I think they have a place for sure. There are just a couple of caveats. One is the kind of just the longevity is a little different.
Yeah.
You're right. The silhouettes are a bit more invasive in their placement, but you may get a little bit more longevity because of it. I
always
think
a balance.
It's always the trade-off. And I don't think either one is right versus wrong. I actually, for the upper face, I will only use the PDO, like the barb sutures, because the silhouette is just, it's too awkward in that area.
Yeah. Do you like them for the upper face? I have to tell you, I find...
I don't think, here's the crazy thing. And this is what I love about you, and what I try to live as well, is no BS, It is what it is, and because otherwise you have unhappy people. If you're BSing people, all that's going to happen is it's going to come back to you.
We want to be a pyramid scheme. We want our patients growing. We don't want to see only new patients once.
Right? No, that is no fun. I don't want to. I want people who are truly in that pyramid. I've watched them grow and get kind of
old with us.
Old with us, right? So to that point, or to that end, really how it boils down is, in terms of just the process and the sweet spot.
Yeah.
I found that the silhouette, probably based on a study that we published, about 2 years is a fairly reasonable expectation, especially in a well-selected person for the treatment. At the same time, I have some people who will come in and say, look, I don't want surgery. I'll take whatever I can get from the non-surgical, and then I'll think about surgery. Like today, I had a patient who flew in from South Carolina, and she wanted to have this done, but ultimately I felt she was more of a facelift patient. And she said, it's fine. This will be my starting point, and then I'll look at a facelift a year and a half or two.
What do you tell is the downtime for your silhouette procedure?
I tell people that you can have some subtle puckering or ripple that can be present. Usually it goes away in large part in the first 24, 36 hours. But I've had people go on the red carpet at 3 days. Not that I planned it that way, but I've had people on the red carpet at 3 days.
Yeah. Because usually because again, I'll use Nova threads, PDO, barb threads. I usually use them as an adjunct add-on after I do my injectables because they're kind of numb from it. And, I never want that patient who says, oh, I look great afterwards. Could you put 1 or 2 more syringes in? And I don't want to make them look bloated. That's when either at the visit or 2 weeks later follow-up, I'll say, okay, we want a few millimeters more movement and lift. That's when I'll put in anywhere from 6 to 10. So, these are different approaches. And I think it's important for our audience to realize that there's no best. You know, you got to find the right procedure for the right patient and the right technique, and there's more than one ways to, you know,
I,
to accomplish what you want.
I agree 100% with
Yeah.
that. And, you know, the thing that you do inadvertently, which is because you take care of a lot of highly visible people, is the idea that when you combine these modalities, you're not making them look kind of hyper pulled or unusual where they have this downtime where they look weird for a period of time. Like I've seen other providers where they're using exclusively, you know, threads where maybe they need some volume, and then they're pulling them, and it's crazy.
I know.
They look crazy
It's
for
crazy.
5 7 days. To me, that doesn't that goes to the opposite
Yeah.
of that word of mouth that you're talking about.
The art is the combination. Tell me about, because people ask me about this all the time. I mean, you see on Instagram, I know you do. They're putting threads in noses.
Yeah. I do not think that's the best idea at all. Obviously, I will say I have a plastic surgery friend who has dual practice in London and Istanbul. His name is Tunç. He is a phenomenal plastic surgeon. He is the only person, he doesn't use threads. He has a suture technique, a semi-open technique to do a rhinoplasty just with suture. I mean, as a lasso kind of effect. That's
Wow.
the closest to work that I've seen that is good. There's no way I would put threads in the nose.
Yeah.
You know, I think we kind of touched or sprinkled on the idea of the fox eye. I just did an interview for that
Can you
actually.
give that to me right now? What do you think? I think that's kind of Bella-ish. What do you think? Give me a little snap.
You know, it's not what these things were designed to do, and
Thank you.
you know, it's just I've seen enough issues from other places where people have tried to do this kind of thing, and there's some real issues with it. So,
Well, you bet. Once all things go back to normal, you better come down to the new PFRANKMD facility. I'll line up the silhouettes for you.
come in. Listen, love the Big Apple, and I've always said, and it's funny, you know, I'm, you know, friendly with Gwyneth
Yeah.
and all of this. I told her flat out. I said, look, I'm a New York kind of guy, not an LA guy, and so we had a bet. Actually, we had a bet that she said I'd end up doing more stuff in LA than New York, and she won. I hate to admit it, but she won. But it wasn't for anything, honestly, at first, other than the weather. So what happened was, and this is a great story.
You didn't have the right facility to work at
I
it.
didn't have the right. No, I don't want to knock my buddy who I was working with. He had a beautiful facility on Park Avenue, but I did it for 5 years. I loved it. I mean, I love New York. But the truth is, I remember I had a month where 3 flights trying to fly into LaGuardia got canceled, like just flat out canceled due to weather. It was in the winter. And so I called my assistant from the airport, O'Hare, and I said, okay, what can you book me on? Because I'm here. And at this point, I was starting to cultivate a following in LA because a lot of the people who were in New York go to LA. And so she said, okay, I'm going to see what I can do. I'll book a hotel and there's a flight and you can just jump on that flight to LA. So I flew out to LA. By the time I got there, she had a clinic booked for me. And then I said, that's it. I'm New York. Because you know, your time is energy and everything else.
Everything.
And I three visits in New York I had to cancel.
That's why we're going to get the Few Frank NetJets card, and we'll go by coastal. Stop off.
If you do that, I'm
Come on.
there. I promise.
You'll come down.
Every other week.
You'll come down to Miami. I'm going down to Miami. I keep opening dates. They keep booking within hours because so many New Yorkers. I mean, I'm fortunate to be quite busy up here in New York, doing fewer patients, but much bigger procedures because there's such a volume of people left temporarily. But I'm going down to Miami. I mean, it's amazing the demand down there. Thank God that there's still a demand for all this stuff. Now, let's briefly talk about that travel thing. I assume you took a break from LA with the COVID. So tell my audience. Are you back in LA?
I am back in LA. I've done so extremely carefully.
Yeah.
I do fly commercial to go back and forth. but generally speaking, I go and I, like you do for Miami, I'll book out a set period of time well in advance. Everybody's pre-screened.
Yeah.
Anybody has a risk factor. A lot of the folks out there have already had it.
I know.
So we have that lined out. So I'm mitigating some risk. And then honestly, when I'm there, I either go on hikes or I'm cooking or taking carry out, and that's it. There is nothing else. There's nothing to do. So
Unbelievable.
it works.
Let's talk about your philanthropic work, because I know you've been working with this for quite a while. And I want the audience to hear about this and your experience with it and how you started it, why you started it, and what's going on with it right now.
Yeah, so in case you didn't know, I am Black. And growing up in the 60s and 70s as a little boy of color, luckily with two parents who were highly educated, but facing some different things, I early on, I really didn't have much of a voice. I was, just purely on the flash judgment, was put in a certain category of which, I'm not a victim in this. Actually, I'm thankful in some ways for it because it gave me a drive to want to do something
Absolutely.
more. But along the way, what I decided, and I made a promise to myself when I was much younger, that if I were to make it, quote unquote, make it, that I would set up a foundation that would help disadvantaged youth of all backgrounds in disadvantaged neighborhoods and environments. And Chicago has no shortage of it, just like New York, or you pick your city.
Absolutely.
And so, for now, a number of years, we've helped send kids to college in exchange for, it's not a handout, it's in exchange for their commitment to develop civic programs for outreach in their community. So, for example, we had one program that was developed last year, more than a year ago, pre-COVID, so almost 2 years, where the young people, men and women, created a program that actually brought together the arts, because I'm involved in the Museum of Contemporary Art in Chicago, with civic outreach. So we had almost 300 kids come and have a round table with the police and the aldermanic group in the Chicagoland area, just to air out issues. And that was their idea. And we facilitated, but they were the ones who went out and did the outreach to say, hey, we want all of you to come to this massive auditorium. And I got to tell you, it's one of these things where it puts everything in perspective, because you and I, we deal with people who maybe have a little line and say, I want this line to look better. This puts it all in perspective. And when I come back to my day job, I look at it very differently. And the stories are very different. I was dealing with a young woman who's at Michigan, came from a horrible environment, horrible background, where I think the father killed the mother kind of thing. I mean, a horrible thing. And this young lady is doing extremely well at Michigan, getting ready. She got accepted to medical school. She's getting ready to go on. And that all happened from this one intersection. And so you think about that, and you think about life and how if we all kind of did our little thing and disrupted the course for maybe 10 or 12 people, the world would be a better place.
Yeah. I mean, this is your pro-aging balance right here. For the audience out there, man, to be the best of who we are and what we do professionally, personally, we all need these things that balance us out. There's no one answer, and there's no one thing that you can do all the time. The next question, I think I know the answer to it, is that what keeps you in your zone? What makes you the best version of you? And you know what? I feel like, unless I missed something, you've told me throughout this whole interview all those pieces of Dr. Few that make you so great at your job as a dad, as just a professional human being. Have I missed anything that really kind of makes you feel, balanced?
I think the one thing, and this is my little secret, is which I don't think is such a secret because I know
roller skating.
No, you're the rollerblader. I don't, and skating. I've seen you rocking out your jams, and especially in the summer. But you know what? It honestly, but that is it. It's finding pleasure in the most fundamental thing. Like you could be jet setting, going to exotic stuff, which I mean, there's a way to do that.
Yeah.
But for you, the pleasure, the look on your face when I see it on Instagram, a video of you like roller skating or blading or what have you, you're like a little kid living your best life. And I have my version of the same thing. Like it could be the most trivial thing, but it's just finding pleasure in that and not getting so, because listen, we both have managed through a lot of hard work to evolve into these practices that are very rare. I mean, they're not, it's like what I like to say to the residents and fellows I've worked with. Not everybody's going to have a practice that is treating a famous person on a regular basis or managing a head of a state somewhere. So to me, I think that's all fine and good, but what makes the deal is not forgetting the pleasure in the little things.
Yeah.
The seemingly little things.
Yeah. And we both are very fortunate because, we take pleasure in most of the things we do. Work, it's like not work or life or family or personal. Like you love your work. I mean, it's such a blessing to love what you do. What people get confused about is that they think if you love your work and you love your philanthropy and you love all these things, that is easy. Right? What's that expression? If you love what you do, it's never work. That's not true.
That's not true. It's because the definition is you're never fully on a professional side. You're never fully satisfied. That's the thing. And I've heard you say it. I still remember as one of my fondest times having dinner with you in Miami. Yeah. When I was there for a meeting. You were there.
Yeah, I remember.
And that was one of the most. But that's the example of just taking it all in.
Yeah, as Ja Rule says, love is pain, and just because you love something, don't mean it don't come with trauma.
It's true.
Anyway, I mean, I really couldn't think of a more perfect interview, and we know each other quite well. I learned more. I'm really kind of bummed now that we can't go to the bar and have a glass of wine.
No.
It will come though.
It will. I'm holding you to it, and I'm going to let you by.
Yeah, I want you to tell everybody how they could reach you everywhere. You got to follow this guy on Instagram too. But what's your best tagline for people to get in touch with you?
Best tagline would be really twofold: either fewinstitute.com, FEWinstitute.com, or Julius Few MD at Instagram.
What about your philanthropy? What's the name of the group and the website?
So it's the Few Initiative for Children, and that's fewinitiative.org. It's a fully validated not-for-profit, and we also have a tagline in Instagram as well.
Amazing. Really, I couldn't thank you enough. As you know,
sorry, hold on.
That's okay. I was just thanking him and saying goodbye. I'm always here for you. I know you are always here for me, and I can't wait to see you again, my friend.
The feeling could not be more mutual. It's great to see you. Keep up the great work, and I'm looking forward to you buying me dinner and a drink.
We're taking the jet, man. We're taking the jet.
That's it. Peace. Love you, man. You take care of yourself.
All right. That was great, man.